dry, warm, or flushed skin. The causes of high blood sugar could be eating too much food or the wrong kind of food, not enough medication, infection, illness, or injury can raise blood sugars, emotional stress, not enough exercise, and weight gain. Treatment includes reporting symptoms of high blood sugar. Diet and/or medication may need to be adjusted and illness treated if present. Hypoglycemia, or low blood sugar, also called an insulin reaction, is another acute complication. Symptoms of low blood sugar can come on very quickly. Symptoms include feeling shaky and sweaty, lightheaded. The person may complain of having a bad headache, feeling very hungry. They may be irritable, have a change in personality, look very pale, and complain of weakness. The causes of hypoglycemia are not eating enough, too much medication, or increased exercise. Symptoms of low blood sugar should be reported promptly. If not treated, blood sugar will continue to drop. A person needs to eat or drink something sweet. You may be asked to give something such as a half a glass of fruit juice, a glass of milk, half a can of soda, 6 or 7 Lifesavers, or jelly beans. Follow with a small snack to help maintain the blood sugar. Blood sugar should be tested in about 15 minutes to be sure it has gone up. The chronic or long-term complications of diabetes take many years to develop. These include strokes, heart problems. People with diabetes are 2 to 4 times more likely to have cardiovascular problems than other people. Poor circulation. When blood sugar is elevated over time, it causes blood vessels to become thick and narrow, affecting circulation. Kidney failure, which may lead to the need for dialysis or kidney transplant. Blindness is another long-term complication. And nerve damage. Nerve damage can affect all parts of the body. Often it leads to a loss of feeling, especially in the feet. In caring for the patient with diabetes, observing and reporting any changes in your patients is very important. Know the symptoms of hyper and hypoglycemia. Also know the causes of hyper and hypoglycemia. This may help you to recognize the changes sooner, such as not eating may lead to hypoglycemia. Meals should be served on time. Be sure it's the proper diet for that patient. Report food and fluid intake, especially uneaten food, as this can lead to low blood sugar, especially if the person is taking medications for diabetes. Check with the nurse before giving any extra food. Know the storage location of juices and other easily absorbed carbohydrates. Low blood sugar needs to be treated quickly. Monitor food brought in from the outside. Well-intentioned friends and relatives may bring in food that is not appropriate for that person. Encourage exercise and activity. As I said earlier, exercise helps to control the blood sugars and blood pressure. It keeps people, their muscles and joints flexible, and makes people feel better. Provide good skin care. Avoid skin irritations and pressure points. If a person with diabetes develops an open area, it may be slow and difficult to heal. Pay special attention to foot care. Poor circulation and nerve damage increases the risk of injury and infection. Wash feet daily, carefully drying between the toes. Inspect feet closely for any breaks in the skin or signs of irritation. Apply lotion to dry feet. Toenails of a diabetic are only cut by a nurse or podiatrist. Care needs to be taken not to cut nails too short or to nip the skin, as this increases the risk for infection. Shoes and stockings should be clean, free of holes, and fit well. Anything that might injure the feet or interfere with circulation must be avoided. Do not allow the resident to go barefoot. Stepping on something could injure the feet. Prevent pressure over toes and feet by not tucking in bedding tightly. Avoid very warm or cold applications to the skin, as the resident may have some loss of feeling. You will care for many patients with diabetes. You are the key person working with the patient. Your observations are very important. You may be the first person to notice day-to-day changes. Watch for and report any changes, as this could affect the health of your client.